In the article published in the New York Times opinion section, closing schools alone is not going to stop the coronavirus. The author, Spencer Bocat-Lindell, a staff editor, argues utilizing ethos, logos, pathos, and shared values that shutting schools down will do and has already done a great deal of harm. Based on personal experience and the fact that I am currently practicing distance learning, I strongly agree with this claim. According to the text, there is no uniform answer stating specifically how risky schools are. However, the evidence that has been obtained indicates that schools, especially for younger children, are not stoking community transmission of the coronavirus. The author builds his credibility by quoting Brooke Nichols, an infectious disease modeler at the Boston University School of Public Health. Nichols states, "The more and more data I see, the more comfortable I am that children are not, in fact, driving transmission, especially in school settings. This indicates that it appears to be that children are not necessarily spreading the coronavirus in schools. This seems to be the case in my community. It is claimed that most people become infected in locations other than schools." The author further develops the argument by utilizing logos. He states in the text, "Restaurants, gyms, and other crowded indoor sites accounted for some 8 in 10 new infections in the early months of the U.S. coronavirus epidemic, according to a November analysis. These statistics show that most of the new infections are occurring in crowded areas rather than in classrooms." Bocat-Lindell then uses Aaron E. Carroll's words, "Because schools are not the major cause of the problem, shutting them down won't do enough on its own to slow the spread of the disease. After talking to various health experts, such as doctors and nurses, I have learned that it appears individuals acquire the virus from other social gatherings in locations near my hometown." As stated in the text, the American Academy of Pediatrics has said that school is an essential bulwark against hunger, social isolation, physical and sexual abuse, drug use, depression, and thoughts of suicide. Removing it places children and adolescents at considerable risk of morbidity and, in some cases, mortality. There has been various reports of students from schools in my community committing suicide in result of school closures. This is a very serious issue which could have been avoided if schools were kept open. Many students are falling behind in their academics due to the pandemic. The author presents a quote, "America's education system already transmits advantage and disadvantage from one generation to the next. Rich kids attend rich schools that propel them forward, and low-income children attend struggling schools that hold them back. School closures magnify these inequities, as many private schools remain open and affluent parents are better able to help their kids adjust to remote learning. Meanwhile, low-income children fall even further behind." By presenting this, the author uses pathos to show the reader that kids are being affected by the pandemic, especially kids from low-income communities. When interviewing a local private school teacher named John Robertson, he stated, "I have continued to teach classes while practicing social distancing throughout the pandemic, and I have not had any students acquire the virus." This indicates that in my general area, the author's quote is correct. Bocat-Lindell believes that there are many ways we could keep schools safe such as making class sizes smaller, staggering lesson times, requiring universal masking, and moving classes to auditoriums, libraries, and vacant buildings. Other measures that could be taken to reduce school closures and the spread of the virus include a suspension of indoor dining areas, combined with federal aid to keep restaurants and businesses running. While it is not likely that much funding will be provided to business owners in my area, the other alternate solutions and protective measures could be implemented in my community and benefit many individuals. The author utilizes shared values to indicate that closing schools is an irrational measure. He states, in the budgetary analogy, trying to reduce coronavirus risk by closing schools is like saving money by canceling your electricity service. Modestly effective in some cases, maybe, but not precisely the first expense to cut. The information presented throughout the article shows that there is no evidence indicating that closing schools should be the first preventive measure taken. In conclusion, there is no evidence indicating that school closures are reducing the spread of COVID. However, it has been confirmed that temporarily shutting down enclosed areas such as gyms and indoor restaurants would be exceptionally beneficial in both my community and throughout the nation.